Hello everyone, this is the final episode about fibromyalgia, and in which we will talk about the diagnosis and the management of this disorder. The diagnosis is based on the clinical manifestation. There is no specific laboratory findings that could confirm the diagnosis. We should look for the generalized pain for more than 3 months. This is the basic. Fatigue and sleep disturbances and other psychological are another contributing signs and symptoms that will help in the diagnosis. And we should exclude other similar conditions by lab investigation. We should exclude rheumatoid arthritis and hypothyroidism. Both of these diseases can manifest the same fatigue and pain and disabilities, but not in the same clinical feature as fibromyalgia, of course. So the diagnosis is based on the clinical manifestation and the exclusion of other similar condition that may look like fibromyalgia. After diagnosis, we should search for appropriate treatment for that patient. There is no specific treatment for all cases. Every patient has its own way for treatment according to its condition and clinical feature. The treatment or management is a multidisciplinary. That means there is many approaches. To achieve that, we have two main approaches, which are non-pharmacological approach and the pharmacological approach for treatment. The fibromyalgia, we should know that fibromyalgia, it's not a curable disorder. It's treatable, but not a curable. We can reduce the signs and symptoms, but we cannot stop the disorders totally. Now let's start with the non-pharmacological approach, and this is a very important part of the management. It's focused on the exercises, psychological, physical treatment. The patient should perform regular daily exercise, aerobic exercises, walking, swimming, and stretching, deep breaths, and stress-releasing actions. All these can help to reduce fatigue and pain and build muscles that will reduce its painful sensation. Also, there's a psychological management which is called cognitive therapy, cognitive behavioral therapy, which is done by a specialist in psychological therapy that will contribute to reducing stress and anxiety and depression in those patients. Also, we have acupuncture, Chinese acupunctures, and other non-pharmacological approaches for treatment. Another non-pharmacological approach is to promote good sleep. This can be done by simple instructions that's given to the patient. The first one is regular sleep time. That means the patient should go to the bed at the same time every day. This will help the circadian rhythm of the brain. And another important note is to provide a cool, quiet, dark sleeping room that will help in sleep, and avoiding caffeine drinks like coffee and other drinks that contain caffeine, and also avoiding screens. This is very important to avoid mobile screens, laptop screens, television screens. These are approved to cause disturbances in the sleep time, so the patient should avoid them at least for 1 hour before the bedtime, and performing some sleep exercise like deep breathing and relaxation before the bedtime. All these factors, if applied regularly and effectively, they will lead to control of the non-restorative sleep, as we mentioned in the second episode, and will help in reducing the fatigue and the pain in the day. For the pharmacological approach, we have 3 FDA-approved drugs, which are pregabalin, duloxetine, and milnacipran. The first one, which is the pregabalin, is anticonvulsant. It helps in reducing pain and fatigue, and can be used initially by small doses that will be increased gradually to the controlled dose. The other 2 drugs, which duloxetine and milnacipran, are both non-selective selective serotonin norepinephrine reuptake inhibitors. The use of them will increase the concentration of the serotonin and norepinephrine in the brain, and will contribute effectively to decrease in pain, decrease in fatigue, and to promote deeper sleep. But there is also, of course, a wide range of side effects for these 3 drugs, and should be used with precautions. These are FDA approved. There is another group of drugs that are not FDA approved, like the tricyclic antidepressant, the selective serotonin reuptake inhibitors, the muscle relaxants, and non-steroidals. All can be used together in a multi-drug system to control the condition. I hope this series of videos about fibromyalgia was useful for you. Wait for the next series about another condition.